We are here at the Prime Health Summit. It's an honor to be with Lieutenant Governor Dr. Donna Lynne. Thank you for being here.
Thank you.
So I was saying earlier that Startup Health Colorado, one of the reasons we wanted to have one of our headquarters here was really because of the leadership of Colorado and having a mission for the state to make it the healthiest state in the nation.
Right.
And I thought that was just extraordinary. So what's the genesis of that? Not many states think that way. Give us a little backstory there, and what does that mean for Colorado?
Sure, well thank you. So Governor Hickenlooper in 2013 put a stake in the ground and said, we want Colorado to be the healthiest state in the country. And I think as a business person, he recognized a couple things. One, health insurance costs are a drag on a lot of companies' earnings. I mean, it's essential to provide it from a competitive point of view, but it costs a lot of money. You know, the expression, Starbucks spends more money on healthcare than it does on coffee beans. So that's number one. Number two, he recognizes that having healthy employees and having productive employees is also a key ingredient to an economy. So we need to push the cost down of healthcare and manage it appropriately, but we also have to invest in people so that they recognize that exercising, eating good food, taking care of their mental health as well as their physical health are important ingredients in any healthy economy.
And it seems like there is this vibrant ecosystem around health innovation here in Colorado. Why is Colorado such a great place for entrepreneurs, for health innovators now? What are some of the reasons?
Yeah, well, I think first of all, you do have a governor who's passionate about this. Second, I'm a transplant myself from New York, and I can't believe how clean the air is, how athletic everybody is. That's right. You don't get stressed as much. The traffic's nowhere near as bad, and at the same time, there is a younger culture. In addition to sort of existing legacy companies that we have here that we're very proud of, you have a lot of startups. You have great universities that are incubating some of the startups. You have, this is often ranked the #1 place for millennials to move to, and they're less likely to want to go into sort of a traditional company where they spend their whole career and like a creative environment. So I think it is almost like a snowball here. We've got the lowest unemployment in Colorado in the country right now. We're at 2.6% unemployment. And it's the lowest it's been in the 41 years they've been collecting the index. So we're low employment, creating jobs, great. We're the skinniest state, you may know that, and we're, I think, one of the most active states by some rankings. So it's a great place to live and work, and I think more and more people are trying to look at that balance, and startups and that energy are really a part of the dynamic we have here.
So you're glad you moved from New York then?
I am.
Yeah. So we're headquartered in New York, and it's just great to be here in this ecosystem at Startup Health. You know, we're building an army of entrepreneurs. We call them health transformers. And one of the exciting things is more of these health transformers are moving here, or they're operating here to solve some of the big challenges. What are some of the big health challenges here that need to be resolved?
In spite of everything that I said, you're asking a perfect question, because there are health challenges here. We are the skinniest state in the country, except that our percentage of people who are overweight, which is 20% of the population, are overweight. If you looked back in 1990, it was 5% of the population. So we have a growing obesity problem. And when you have obese people in your infrastructure, they cost more money in terms of health care, they're not as productive, and there's all these other diseases that are a byproduct of that. So we have a growing obesity rate. We have a real disparity between people of color and their obesity rates in Colorado, and those are growing pretty substantially, as well as young people. So that is a huge challenge for us, like most of the country, to manage the obesity rate. We also are a big state with a lot of rural areas, and rural healthcare is pretty challenging. You sometimes have to drive an hour and a half to get healthcare, and even farther if it's sort of advanced care, tertiary care, and quaternary care. So making sure that our rural populations have access to health care, because they're an important part of our economic fiber, is also critical. The third is we have some pretty high rates of suicide in Colorado. We're in what's called the suicide belt, which is mostly the West, so we rank 9th in the country around suicide. And we also have some substance abuse issues, opioid abuse, heroin abuse, and so forth, that you've probably heard about in the media. So we're trying to tackle those problems, at the same time being very proud of many of the advancements that we've made.
So if you could wave a magic wand and solve one big challenge, or have the people here in this state change one behavior, say, what would that be?
I think it would be around mental health, because mental health still carries a little bit of a stigma. And we know that 1 out of every 4 Coloradans either has a behavioral health issue or a substance abuse issue. And if you're tucking it under, you're burying the problem, and sooner or later it's going to pop out. So I think us acknowledging that mental health is as important as physical health, and making sure everybody has access to treatment, is an important part of what we need to do as a state.
Now, you had a background, or have a background in health and healthcare. What guided you to have that background and passion for health? I
spent a lot of time in New York working for 4 mayors and thinking about a very big workforce. City employees in New York, a number of a little over 300,000. I mean, that's the size of some cities in and of themselves. And they're hardworking, not always highly paid people who need healthcare benefits. And so when I saw that healthcare benefits weren't being provided efficiently, I said, how do I change this value proposition? And how do I help do this in a very professional way, give people choice, give people access to information, but continue to work on the cost of healthcare. So I often say I've been a purchaser of healthcare as an employer. I've been a payer, meaning an insurer. I've been a provider working in healthcare systems like a hospital system and like Kaiser Permanente. And I certainly have been a patient. So we all as patients have points of view of experience that have gone wrong as we've used the healthcare system. It's an exceptional time, both for good reasons and bizarre reasons, I think, in terms of health and healthcare. What are your predictions? Where do you see things going, say, over the next 5 years? Are you optimistic? Are you concerned? It is an interesting sort of economic quandary, I think. In most businesses where you try to spend more money, there's a value proposition, right? You return workers perhaps to more productive states, or you invest in technology and it creates some efficiency. In healthcare, most of the money that we spend is on people in the last 6 months of life. And to put it in a sort of unemotional term, that's generally not when they're being productive. So businesses who foot most of the healthcare bill have to spend that money. It's the compassionate and right, humane thing to do, but at the same time, there's newer technology, whether it's new drugs, it's new medical devices that are allowing us to live much, much longer lives, well into our 80s, our 90s, 100, and there's a cost to that, but there isn't necessarily a return on investment, to put it in sort of traditional business terms. So I think we have to recognize that we're spending a lot more money, and it's wonderful because people are getting cured of disease, they're being able to live with disease, they're continuing to be active into their 80s, 90s, and 100s, but who's going to pay for that? So if we turn those years into healthy years, that'll be one solution. We just got to figure out how to do that. I think I have an idea, because I heard that you've climbed all the 14ers, is that right? That's correct. So what I was going to ask you for the last question here is, health is such a part of the culture here in Colorado. The people talk about health, the people are doing healthy things. What do you do to stay healthy? Well, it's so funny you say the 14ers, because when I lived in New York, I didn't know that was a word. But when you live in Colorado, you have to know that's a word. And what I try to do is I still climb. So I'm about to climb Mount Whitney in California in July. Wow. I'm starting to do some of the not as high as 14,000-foot peaks. They're called the centennials because they're getting close. It's the top 100 peaks in Colorado. But even the casual walk, you don't have to be aggressive and get into all the technical kinds of hiking and climbing and mountaineering that I do and a lot of other people do. You don't have to be a mountain biker. If you just get out and walk, it could be during your lunchtime, have a walking meeting, make sure you take a 30-minute walk. There's a lot of evidence that shows even something as simple as that will improve your health, your heart health, and when your heart health works, a lot of other things are working along with it.
Well, thank you for your inspiration and
you.
leadership. It's meaningful, and I think a lot of the nation and world even can learn from what's going on here in Colorado.
Thanks, and welcome to Colorado.
Thank you. Thank you.